The first nursing diagnosis for this patient is impaired gas exchange related to CO2 retention as evidenced by PO2 level of 121, respiratory alkalosis status, Vapoderm respiratory treatment, Rales heard upon auscultation, and shortness of breath upon exertion. The goal of this nursing diagnosis is that by the end of the shift, patient will maintain improved gas exchange as evidenced by normal breath sounds heard upon auscultation, normal PO2 and CO2 levels, no laboratory reports of respiratory alkalosis, and no shortness of breath upon exertion. The first intervention is to establish baseline value for respiratory assessment. The rationale is to distinguish age-related changes that may mimic disease state from disease. The second intervention is to auscultate lungs every 4 hours, accounting for age-related anatomic changes, and to report any abnormalities. The rationale is to detect abnormal breath sounds. The third intervention is to encourage adequate fluid intake through J-tube or IV, and record I's and O's. The rationale is consuming adequate liquids can help to liquefy secretion, reducing the energy required to mobilize them, and to monitor fluid status. The fourth intervention is to assist patient getting out of bed and avoid bumps and scratches. The rationale is to avoid possible trauma and tissue bleeding. The fifth intervention is to ambulate patient slowly, and this is to avoid possible hypotension. In the evaluation of the goal was not met. Patient still had shortness of breath upon exertion. Rales were still heard upon auscultation bilaterally. PO2 levels remain elevated at 118, and laboratory results continue to show patient suffered from respiratory alkalosis. The second nursing diagnosis is acute pain related to tissue damage secondary to esophageal cancer as manifested by pain rating of 8 out of 10, tachycardia, verbalization of pain located in neck and back. The goal of this nursing diagnosis is that by the end of the shift, patient will be free from pain as evidenced by verbalizing a pain rate of 3 out of 10, no pain located in the neck region, and heart rate within normal range of 60 to 100 beats per minute. The first intervention is to assess patient's pain using the cold spa format and pain scale. Continuous assessment documents patient's subjective complaints and behavior with organic pathology. The second intervention is to administer Loratab as prescribed. Return in 30 minutes to reassess patient's pain level and medication's effectiveness. This establishes a trust-caring relationship that encourages accurate communication. The third intervention is to help patient into a comfortable position and use pillow to support painful areas such as lower back and neck. The rationale is to reduce muscle tension or spasm and to redistribute pressure on body parts. In the evaluation of this goal, the goal was met. Patient was administered prescribed analgesic at 0900. Upon reassessment, patient stated he was comfortable, but neck was still stiff. His heart rate went down to 88 beats per minute. The third priority nursing diagnosis is impaired skin integrity related to abdominal incision secondary to chylous ascites removal, as manifested by history of diabetes mellitus and total parenteral nutrition intake right drain from procedure. The goal of this nursing diagnosis is that by the end of the shift, patient will show improved skin integrity, as evidenced by skin remaining intact, skin turgor remains normal, and no signs of inflammation or infection. The first intervention for this nursing diagnosis is to inspect patient's skin every 8 hours, describe and document condition, and report changes. The rationale to this is to provide evidence of effectiveness of skin care regimen. The second intervention is to keep patient's skin clean and dry and lubricate as needed. Do not use irritating soap and rinse skin well. These measures alleviate skin dryness, promote comfort, and reduce risk of irritation and skin breakdown. The third intervention is to keep linen dry, clean, and free from wrinkles. Change wet bed linen immediately. The rationale to this is dry, smooth linens help prevent excoriation and skin breakdown. In the evaluation of the goal was met. Patient's skin remained intact and skin showed no signs of infection or inflammation. Skin turgor remained normal and there were no skin tears or lesions. Some additional nursing diagnoses include excess fluid volume related to suspected chyle leak secondary to pleural effusion as manifested by chylous ascites, abdominal girth of 43 inches, and swelling of lower extremities. Another is imbalanced nutrition, less than body requirements, related to difficulty swallowing secondary to esophageal cancer, as manifested by jejunum tube placement, TPN 1574 kcals, and MPO status. The teaching plan of this patient is knowledge deficit related to deep breathing exercises. The goal of this teaching plan is that by the end of the shift, the patient will be knowledgeable in deep breathing exercises as evidenced by verbalization of exercise and proper demonstration of deep breathing exercises. The first intervention is to establish an environment of mutual trust and respect to prevent patient anxiety and to ease the line of communication between patient and nurse. The second intervention is to identify the patient's level of consciousness and perceptual development. The third intervention is to teach deep breathing exercises and demonstrate to the patient correctly. The fourth intervention is to encourage the patient to repeat the demonstrated exercise. In the evaluation of this goal, the goal was met. Patient was able to demonstrate the deep breathing technique twice.